It's much easier to know your enemy. Genomics allows us to know our enemy better. If genomics can alter therapy, that's a game changer.
The arrival of genomics nationwide, I would hail as the most exciting event that I've yet witnessed. In my almost 40 years as a pediatric brain tumor physician, we're no longer struggling in the dark.
But genomics is certainly going to impact pretty much all fields. Most, if not all, diseases have some genetic basis.
Your son has a change in his genetic code.
Traditionally, I would tell parents there's a 70% chance we'll never figure out why your child has epilepsy. We've been able to reduce that with the advances in genomic medicines to only about 30% of children having an unknown diagnosis. It gives you the peace of mind that you're not fighting an unknown name or a beast.
We look at cancer cells in the past under the microscope, and it's kind of like if you were looking at a city from afar and you see the silhouette and the outline. That's all we've seen. Now with genomics, we can sort of go into the city, drive around the streets, and look into all the doors of all the buildings and know exactly what's going on. It's also giving us many more different categories of cancers in terms of varieties or variations of a particular type. That helps us determine prognosis. What is the risk category? What is the chances of this patient being successfully treated by a certain type of therapy or not?
We now have the ability to do most of these tests here in-house, which is fantastic. We can offer this test really easily to almost anyone who walks through the door.
It's rare for a pediatric institution to have real robust genomic medicine.
We've got a genomics tumor board for childhood brain tumors, which is just 2 years ago would have been almost unthinkable.
We're very lucky to have the team led by Dr. Martison Wilson.
The integration between scientists or laboratory-based researchers and clinicians is really vital, not only to give the right patient care in terms of making the diagnosis, but also to change the future.
It's only the beginning of what I consider to be an amazing partnership. They're going to be building a test for us that's going to be very unique, unlike any other test in the entire United States. The things that they learn are going to really advance our ability to provide better care for patients.